Of course, no vaccine's 100% effective, and that means doctors need powerful treatments to help coronavirus patients now and in the future. Denver 7's Jessica Porter has more on a new drug being distributed by UCHealth. It's intended to help patients most at risk. Jessica?
UCHealth has a limited supply of just 650 doses of the experimental drug created by Eli Lilly. I spoke to a Denver man who believes the treatment kept him out of the hospital.
So initially, it really is just lost the sense of smell. And that was the first thing I noticed. On the 23rd, I woke up congested.
When William Stanton tested positive for COVID-19, he was already experiencing mild symptoms and knew he was high risk.
So I'm a diabetic. I also have asthma, and I also have high blood pressure.
A nurse recommended a new antibody drug called bamlanivimab.
Within hours of the transfusion being done, I could feel the congestion going away.
Doctors say it's not a cure, but is intended to reduce the severity of COVID-19, keeping high-risk patients out of the hospital.
So there's proteins that live on the surface of a virus that this will then latch onto. And the idea is that it'll keep the virus from its factory. It's basically trying to shut the factory down.
Bamlanivimab is given through an intravenous infusion in your arm. It's only being offered to patients within the first 10 days of infection who meet strict criteria.
And this is really intended for people that are feeling sick, not asymptomatic individuals, and have some other comorbidity that puts them at a higher risk for ending up in the hospitals.
It's still too early for doctors to determine how effective the drug is. Stanton believes the drug may have prevented him from getting seriously ill.
I mean, this is a scary thing. And like the nurse was telling me that it could literally be within minutes. I go from feeling okay to feeling really bad, and I feel fortunate to not have to have gone to experience that.
That drug is available at UCHealth and multiple outpatient treatment centers. But remember, it will only be given to those with pre-existing conditions that put them at high risk. UCHealth says because it's a treatment for COVID-19, most insurance plans should cover it. Jessica Porter, Denver 7.